Thanks, everyone. Appreciate you coming out, joining tonight. For those online, welcome. Appreciate you joining online. We have a great presentation. We're going to be talking about rider or racer injuries. So not only injuries, but prevention and recovery if you do have an injury. And this will span the whole spectrum. You don't even have to be an athlete. A lot of this stuff is going to apply. Some of the things we'll be talking about are brand new. You won't really see them anywhere. Our clinic is internationally recognized for innovation in orthopedics. We have athletes from all over the world that fly into Casper, Wyoming and see us for the newest in orthopedic care. On the front of our screen here, we have Lockie Hughes, who's with us here in the audience today, one of our patients as well. We'll hear from Lockie real quick before we get into the presentation.
Treatment at McGinley Clinic of Wyoming to its contract instead of McGinley Clinic offers minimally invasive treatments for most falls including arm. They got me back to good performance and back to the podium. Go check out McGinley Clinic today.
All right, Lockie, appreciate you coming and doing that for us, and glad we were able to get you fixed and get you that championship, help you get the championship this year. That was exciting to watch. So I'm Joe McGinley. I'm the founder and CEO of McGinley Orthopedics and the McGinley Clinic. We're also the official partner of Pro Motocross Racing, so you'll see us at the Pro Motocross races all summer. We treat a lot of the factory team riders at our clinic, and we do the Medical Minute live on the TV show about every other week as part of the program. I'm an interventional radiologist and sports med physician, so everything I do is on the minimally invasive side, meaning we don't put you under general anesthesia and we don't cut you that you need stitches. That's really a good divider as far as what we do versus traditional orthopedic surgery. I'm also involved in medical societies, and I'm still a clinical instructor with the University of Washington. My background's from Philadelphia. I did an MD, PhD back there. Mechanical engineering is where my base education came in. I went on to Stanford, did my residency and fellowship out there, and then I've been residing in Casper, Wyoming for about the last 14 years. Currently, I'm a professional mountaineer, so I've done 6 of the 7 summits, going back for Everest again this year. I've done speed climbs on 2 of those mountains, and we'll be attempting a speed climb on Everest, meaning less than 2 weeks from base camp to summit and back home for that matter. So we'll give it a go, see if I can wrap up the 7 summits as well. So our practice at McGinley Clinic is patient-centered, and I know a lot of places say that, but we actually do that. So when you come into our clinic, everything that's done is customized to you and your problem. We'll go through it from start to finish, from diagnosis to coming up with a treatment plan that works for you and trying to meet your goals as far as patient care. It starts from the latest technology and diagnosis, the latest products as far as treatment, and then advanced recovery, getting you back out there into the sport you love. So what we're going to be talking about today, prevention, treatment, and recovery. That's essentially what we're going to be covering. We'll talk about diagnosis because identifying the problem really is the key to success with all of these things. We'll talk about biologics. There's a lot out there, stem cells, PRP, but there's numerous different facilities doing them. There's quite a bit out there that's inaccurate and incorrect, so we'll try to get you on the right path for biologics. And then talk about some of the latest things you may not have even seen yet that are up and coming. We get access to a lot of the products and technologies first because we do a lot of development with a lot of companies, so we'll see it even before it's readily available to everyone else out there. So as far as diagnosis, that starts with good imaging. This is a little bit of exaggeration, but some places, the technology has been there for 10, 20 years. They haven't really upgraded anything. And really what you get is what they have, and that's it. At our facility, we really focus on making sure the diagnosis is correct. We are the first in the US and even internationally for some of the equipment that we have to diagnose biomechanics and diagnose injuries. I use augmented reality in my practice. I've been using it for about 8 years. We probably, I don't know if it's 100% fact, but we probably were the first site using augmented reality for treatment of patients. Again, I've been using it about 8 years. I had never heard of anyone in medicine back then using it. Now you'll see it a lot more robust across the country, but we are one of the pioneers in that area. Standing CT scanner. This is going to sound like it's common sense. However, we were the second site with this particular technology. Essentially, if your knee's hurt or ankle's hurt, right now if you go in for imaging for an MRI or CAT scan, you typically lay flat on the table. If you have a problem or an injury, when you lay flat, it usually doesn't hurt because you're not weight bearing, you're not putting forces on those joints. So we worked with Curbeam to come up with this technology. I was actually the first human they scanned on it. And we brought it into our clinic to evaluate all the joints, the biomechanics from the pelvis on down through the feet with you fully weight bearing. So it sounds like common sense, but it does make a big deal as far as dynamic imaging. You want to try to replicate the problem as best possible. It's very low dose as far as radiation. It's a CAT scanner, but low dose radiation, so safe even for kids to get scanned. So we scan thousands of patients. We are one of the first sites with this new MRI scanner. Again, lower power, meaning it's less problematic for the patient, but it integrated AI technology to give you an excellent image on the quality side. So it's great to have this. We are the only spot in Wyoming with it. There's only a handful in the country with this newer scanner from Siemens, which integrates AI to perform accurate diagnosis, easier for the patient. Dynamic imaging, we're big on this. That's me with my AR system. I'm treating one of our motocross patients in that image. And then dynamic ultrasound imaging is really the key, right? So, if you're sitting there still and it doesn't hurt, but, if you're moving your arm, moving your body in a certain way and it causes a problem, you have to try to replicate that to diagnose that. Ultrasound's key. So we use ultrasound in up to 50% of our patients in real time. We can simulate most injuries in real time and then come up with a diagnosis that you may not catch on a CT scanner or MRI. These are newer technologies. We're looking at getting this into our facility. It's a handheld X-ray. I saw it at some of the motocross races this past summer. Essentially, you can bring it anywhere and get an X-ray. It doesn't require a blood line room or anything else. It's very contained. This is the latest technology. It's portable, comes right in a case that you can check on the airlines. So we're seeing this a lot more at the races in real time to diagnose fractures, broken bones, things like that. So now that you've gone through diagnosis, now the decision comes. This is where it gets complex. What do you do? So identifying a treatment pathway. So the biggest question, if you have an injury, whether it's a chronic injury or an acute injury from an accident on the track, do you need surgery? Previously, if you had an orthopedic problem, you would always go to the orthopedic surgeon. That's just how it was. However, the field of orthopedic medicine and interventional orthopedics is growing quickly within medicine. So the question is coming up more, do you need surgery for these type of problems? If it's an emergency, right, if you have a crash on the track, major injuries, you need surgery. There's no question about it. You need to go to the hospital, you need to go to the local ER, you need to make sure that you're safe. If it's subacute, meaning, maybe you broke your collarbone, you broke your wrist, those typically don't require immediate surgery. So then you want to go to a specialist that does that particular surgery on a routine basis. So then you try to find a specialist that does wrist fractures, that does clavicle fractures on a routine basis. That's who you want to see. So trying to get to the right surgeon for the right problem, if you have the luxury of doing so. Now, if you come down the other pathway, do you need surgery? If the answer is no or maybe, that's where the area of orthopedics is starting to bloom, and we're starting to see many, many options. So minimally invasive approaches will work in those people. I've had some of this stuff done that we're going to talk about. My wife Diane has, most of our staff has, and like I said, we treated a lot of professional racers with these procedures. So when should I get treatment? Sooner is typically better with minimally invasive procedures. The sooner you get it taken care of, the less likely it'll become a chronic problem. So from our standpoint, without knowing exactly what the injury is, sooner is better than later. How long do I have to recover? Depends on what we're doing for you. So if it's something as simple as carpal tunnel, which a lot of the car racers get just from gripping, holding onto the wheel, you can get carpal tunnel at an early age. There's treatments out there now that you're only out for just less than a week. You can get back out there driving without issue. So how long you have to recover depends on the problem we're actually fixing. And then where should I go for treatment? You want to go to someone that actually specializes in these procedures. We help direct people. So, if you had a wrist fracture and you were located here in Indiana, we would find a surgeon that's using the latest technology that does wrist and hand surgery on a routine basis, get you in to see them. We have a network of surgeons that are, we're loosely working together across the country to get you into facilities to get you treated correctly. So identifying a treatment pathway depends where you fall on this spectrum. And it's not straightforward. So these are the categories, and I'll show you how they overlap. A lot of you are already doing this. That's why you're here at PitFit. You're getting the physical therapy, sports massage. You're trying all the preventative measures to make sure you don't get injured. So prevention can be the key in that situation, making sure you're treated correctly ahead of time. If you have something flare up just, from training, corticosteroids or cortisone can help. You don't want to depend on them, though. They can be corrosive. They can cause problems over time, but they can be good for a one-time treatment. Try to get you back out there without missing any time. We'll then get into the PRP stem cells, the biologics. These are really growing rapidly here in the US. They're very robust in Europe. They have been for decades at this point, but the US has been lagging a little bit on the cell therapy. And then sometimes, as I mentioned, you may need surgery. And then after all this, recovery is going to be key. No matter what you're doing here on this side, making sure that you're taking care of yourself after treatment to prevent it from happening again and getting you back out there on a routine basis. So this is what that really looks like, and it can get a little confusing because there's quite a bit of overlap in these categories. So on the prevention side, there's some stuff that's pretty straightforward. So bracing, at our clinic, we use a lot of dynamic bracing. So even bracing technology has changed over the years to allow some motion while still providing a protective effect depending on what's being injured. An example can be offloading braces on the knee. If you've had a knee injury, if you've had, say, a medial meniscus injury or an MCL injury, we would have you in a medial offloading brace. And what that does is take some of the force off the inside of the knee. So you can start transitioning back to weight bearing and still protecting the inside of that knee a little bit. If it's lateral meniscus, it would be a lateral offloading brace. So you can prescribe them specifically to the actual problem. So dynamic bracing. Professional training and coaches, preaching to the choir here, you guys all get that. You're doing all the training, you're doing all the right stuff. That's key to injury prevention. Just going out there trying to compete, that's not the way to go. It's more for the novices and amateurs, but at the professional level, you all have coaches, you all have trainers. That's going to be key to success. Nutrition's a big one. You take care of your. I'm a motocross rider. From my dirt bike, I spend all type of money on parts and tune-ups and everything else on it. But you have to make sure you're doing the same with your body, right? Your body's more important than that bike. It's more important than your car. Your car, if you break something, you can replace it. Your body, you might not be able to. So you want to make sure you're spending more time and more focus on your body as much as you would on your car to make sure that you're at peak performance. So nutrition is key. Cognitive training, we got to see some of the cool stuff you guys get to work with here. We had a little bit of time to walk around and play with some of that. That's really cool to have that for you here at this facility. Treatment, PRP stem cells we're going to get into. And then this is the list of stuff that's out there, and this list keeps growing. I was just at a conference just a few weeks ago, talked to several product providers. We're looking at least 4 or 5 new things for our practice that we weren't doing, even a month ago. And we're pretty much on the front edge of a lot of these procedures. But this list continues to grow as far as what we can do from a minimally invasive standpoint. And then all of this on the bottom overlaps. So physical therapy, cryotherapy, oxygen therapy, cold therapy, those are all in the anti-inflammatory healing recovery pathways. And then a big one at the bottom, mental health. For all the racers out there, you guys are competing at a high level. It's stressful, it's tough. You're dealing with the team, you're dealing with the competition, you're dealing with the fans, you have family life. It's hard to put all that together. So having mental health coaches, sports psychologists are very, very specific in these areas. It's really important to have that mindset up front. I had a couple of people that sort of fought me on that. They said, "Doc, I'm not crazy. I don't need a sports psychologist." I said, "That's not the point." I said, "You just have to think of this like your physical therapist, massage therapist, and everything else. They're trying to help to focus you and get you in the right direction for the competition. It's not that you're crazy, otherwise you wouldn't be here. This is about making sure you're prepared just like you are physically. There are specialists out there that specialize in mental health for racing specifically. So it's important to go down that pathway as well."
A bunch of coaches online saying, "Thanks for saying that."
Yeah, those are always tough conversations on the sports psychologist side. But, we work with one of the NFL teams. They actually have a sports psychologist that travels with them on the plane, is on the sideline the entire game. Most of the players will see them right before the game. They'll talk to them on the flight out there, and then they'll have appointments all week leading up to it. I don't think any of those guys are weak. So I think what they're trying to say is, how do I get a leg up on my competition? How do I be the best that I possibly can? And my ego is not in the way of this one. I want to be the best I can. So the mental health, mental preparation, it really is key. And there are a lot of stressors out there that these professionals can help you deal with. Okay, so we're going to talk about the power of cell therapy. This is regenerative medicine, PRP stem cells. I've been doing this now for probably almost about 14, 15 years. We were one of the first sites here in the US doing it. We're behind in the US, Europe, and Asia is doing it a lot longer than us, but we're starting to catch up. So this is using your own body's cells to repair problems. So platelets, nucleated cells, essentially quote unquote stem cells, growth factors, signaling proteins, teaching your body to heal itself. When you have an injury, your body doesn't have the robust ability to repair some areas. For example, if you injure your Achilles tendon, If you were just to take it and cut it, not that you would do that, but if you did, there's very little bleeding from your Achilles tendon, meaning there's not a lot of blood flow from it. So when it gets injured, it doesn't have that same ability to repair itself. Say, like when you cut your skin, you get a lot of bleeding, it self-repairs. It's the same process. We're just taking the cells that repair your skin, injecting them into the Achilles to allow that tendon to heal. So we're tricking the body to do what it normally does. So these cells can accelerate your repair process. So after an injury, I'm very big on getting people in early for cell therapy, improving tissue function and quality, decreasing pain. It does have an anti-inflammatory effect, and then prolongs or even eliminates the need for surgery in some cases. Outside of the sports area, I treat a lot of patients for arthritis. So middle and older age individuals that are dealing with arthritis who don't want a joint replacement, these cells are an excellent option for that, for long-term recovery. So how do these things work? This is the simplest way I can put it. I like to use simple analogies because they make sense to me. It's how I sort of mentally justify these things and then try to prove it from the clinical standpoint. So PRP and stem cells, if you have arthritis in your joint, if we were to take a look at that joint surface, the cartilage in your joint, it would look like a road with a whole bunch of potholes in it. So that when you're walking, let's just say your knee joint, when you're walking, those rough surfaces are rubbing against each other. That rough surface, that friction causes inflammation in the bone. That's what you start to feel as pain, is the inflammation. So when that happens, when we inject stem cells in there, those stem cells fill in those cracks and crevices, those areas of defects in the cartilage, and it seals the surface. So it's like surface paving of the road. You're not getting a brand new road. We're not, going to give you a road like you're 20 years old again. We're filling in the cracks and crevices. It's the surface paving, so that surface is smooth, and you no longer get that rough rubbing along the joint surfaces. That's as simple as I can really make that analogy, and really that's how it works for both PRP and stem cells for arthritis. So how are they produced? PRP, or platelet-rich plasma, we get from your blood. It's just a simple blood draw. We process it right there in the room, inject it into the area of abnormality. Stem cells are like the big brother of PRP. We get that from your bone, your pelvic bone in the back. We also spin that right there in your room. It's your own cells. These are not from blood banks or anything else. And then we inject it in the area of problem. As far as which one you need, a very simple way, in generality, but again, not everyone falls in this category. If it's a soft tissue injury like your Achilles, plantar fascia, ligament, meniscus, most of those, PRP works fine. It's a little bit less invasive, a little bit easier. If it's a bone problem or back problem, so if you have a neck injury, back injury, if you have a bone that hasn't healed, and if you have arthritis, then stem cells are typically required to fix that. That's sort of the general way I break it down. Sometimes there's some overlap there, but really that's how I justify one versus the other. All of this is done right in the room. Those cells never leave the room, and we inject them right back into you. They're your own cells. What's it commonly used for? So if you fail conservative care, so again, physical therapy, even corticosteroid injections, although I'm not a big fan of steroid injections, unless you need them to get through an event. Acupuncture, chiro, massage, traction, inversion therapy. These are all the conservative measures you can try first. And then what the cell therapy does is bridge the gap between conservative care and surgery, which is invasive. If you're not a candidate for surgery, there's some people that have health issues, they can't have a joint replacement. These are excellent options for that. Or the patient wishes to delay surgery as long as possible. So when I was training for one of my mountain climbs several mountains ago, I tore my hip labrum. So every time I walked or run, I could feel clicking and popping in my hip. It was painful to even go a block or two. So it impaired my training. So I saw a surgeon. He said, "Oh, you need to have a repair. You need to shape the bone." And so I'm going to try stem cells first. He told me it would work. I said, "I do this all the time." And it does. So I did a stem cell injection on my hip and labrum. That was 6 years ago. And I've had speed climbs on Denali, Aconcagua. I've been to Everest. I've been down to Mount Vincent. So I've summited 3 of the 7 summits after stem cell treatment, and I'm still asymptomatic. I run probably 30, 40 miles a week, no symptoms whatsoever. So it worked well for me. I was told I needed surgery. I went down the conservative pathway, and it's been great as far as my hip goes. Stem cells and PRP can treat pretty much everything that's non-traumatic. And if you're out on the track and have a crash, a major injury, this is not part of the conversation. You need to go to the hospital, you need to get fixed. However, if you're dealing with things on a more chronic basis, Achilles, meniscus, labrum, ligaments, degenerative disc disease in your back, fractured non-unions, things like that, these cell therapies can help. I've treated thousands of patients at this point, and we have data on all of them as far as the results of the cell therapy. This is a short animation for the Achilles of essentially how it works. It's an outpatient procedure. It's done in the office. You're wide awake. You have a partial tear of your Achilles. Again, if it's completely torn, this won't work. So you have a partial tear of your Achilles. We use ultrasound. We're injecting the PRP with ultrasound to make sure it's exactly in the right spot. You have the cells that look cool on the screen come into the area to fix the tissue, so your platelets are going to that area. They stimulate the repair of that tissue, and then your body self-repairs that tissue. It's as simple as that. It's as simple as the concept goes. It doesn't work for everyone, but for most people, we see about an 85 to 90% success rate with this. Biologics have been used in a lot of sports for a lot of individuals. Peyton Manning, Ray Lewis, Nadal, Woods, Bryant, Bartolo Colon, all these guys had PRP or stem cell therapy. For those that remember back when Kobe Bryant sort of looked like his career was tapering off, he went over to Europe and had some magic treatment. Actually, it was PRP that he had. He came back, he had some of the best years of his career afterwards. No surgery, went over, had PRP over in Europe because they were more advanced at the time. And they came back over here and just really killed it for this last few years. So all these guys had it. Peyton Manning, again, another one, Aaron Rodgers as well. So these guys all had cell therapy and had incredible results. Here's some of the latest and greatest new technology. So this is called 10X. This is essentially, if you think of the concept of a Dremel, where you can sort of not tissue, you carve bone, you can carve essentially contour metal, contour wood. This is the same concept in medicine. So it doesn't have a spinning tip, it has a needle that vibrates at high frequency. So if you have bone spurs, things like that, we can actually go in and contour the bone just through a needle stick a few wide away. So just a little bit of lidocaine, no sedation. We can go in and shape that bone, get those areas that are causing problems with this particular type of device. We also use it for shoulder impingement. So if you're moving your shoulder and it's catching up in the shoulder, we can go in and clean that out with this particular device as well. That was a procedure we developed probably about 8 or 9 years ago. Some of the other new technology, this is for carpal tunnel. I'm one of probably 100 or 200 docs now that are doing this. No more big scars on your hands. So if you have carpal tunnel syndrome, we go in with this little catheter. It's actually only about maybe that wide at the tip. We come in up at your wrist, we slide under the ligament that's pushing on your palm, and then we cut the ligament from underneath and then take the device out. The reason being, for traditional surgery, even with mini open surgeries, this big cut right down the palm of your hand. You can imagine if you're a driver or racer, that's going to be painful and problematic having a scar right on the palm of your hand. We're coming in from back here and cutting from underneath. We've had people back to sports within 48 hours after this procedure. So it's very quick recovery, very quick return to sports. We're seeing it a lot in motocross, so a lot of motocross racers that get arm pump plus carpal tunnel syndrome. They're having the traditional surgery, they're out for several weeks in the recovery. With this newer technology, we can treat the carpal tunnel, get them back out there, no scar tissue whatsoever along the skin surface in that area. We're a center of excellence for this, meaning we've published papers on this, we've treated a large number of patients, we've done educational talks on it. So we're one of a handful of centers of excellence. And this little scratch down here on the wrist, that's the size of the scar. That's literally about how big it is. We do a full carpal tunnel release. And again, you're releasing that whole ligament within the hand. That same company also has a device for trigger finger. If you don't know what that is, it's when you bend your hand down and the finger gets stuck. And you have to sort of flip it back out again if you can't do it on your own. It's very painful, so if you lock that finger down, with the patients that have that, they're probably cringing with me and demonstrating it, because when that finger locks down, it hurts quite a bit when you have to flip it back up again. Some have it where it intermittently clicks and locks, but this is another device. Again, we make a tiny little scratch in the skin, we go under the area that's locking and release it from underneath, back to activity within 48 hours. So pretty quick recovery on this as well. So those are some of those latest devices. On the orthopedic surgery side of things, this is a product we developed. It's called the IntelliSense drill. It's a handheld robotic, meaning there's sensor tech. It looks like a drill, right? When you're looking at it, it looks like a drill. There's several sensors inside here and almost 100 patents on this technology, believe it or not. So what it does, if you drill, if you just took a 2x4 and drilled through, it would stop when it got to the far side, when it broke through the board. Same thing if you're drilling through bone with hardware, it will stop when it gets through the bone within tenths of a millimeter and tell you exactly what size screw you need. Right now, that's an entirely manual process. So if you were to have a surgery to have a fracture fixed anywhere in your body, they're using a drill that's less advanced than what you find in the hardware store. It's 100% based on manual feel of the surgeon. They can't see the other side of the bone, and they stop drilling when it feels like they get to the other side. And then the crazier part is the standard of care is you take a little device called the depth gauge, has a little hook on the end. You place it down the hole, you try to grab the other side of the hole without seeing it, and then you read a ruler. That's how you measure the screws. That's standard of care surgery across the entire planet. So we're trying to change that with sensor technology in there so that entire process is accurate and automated. The key for you guys, if you have a screw that's sticking out even by a millimeter or two, and you're a competitive athlete, you're going to feel it. Even if you're not a competitive athlete, that's sticking out there can really irritate tissues on the other side of the bone and not even know it. We see this all the time. So IntelliSense is a handheld robotic helping surgeons. If you have wrist fractures, this is a plate we developed to help heal the wrist bone, the fracture of the distal radius, quicker and stronger. So our plate with these blades in place is 5 times stronger than the standard plate. This is really key in motorsports, especially if you're on the motocross side. You have a lot of force on those handlebars. This plate will help those bones heal quicker and then provide a stronger construct because of the triangular configuration of these blades. Right now, if you have a fracture, just think of this black area here. That would be what you would get, just a flat plate right on the surface, and then you'd have to wait for the bone to heal. We've added these gold structures. They're not gold, they're titanium, but to match our colors, we have them as gold colored. So titanium, and they create a triangular construct that holds those bones in place, and you get great alignment of the joint surface. These are some other technologies that are out there that we use and others use. Shockwave therapy, you'll see this at some recovery centers all over the place, all over the US. It's using high energy shockwaves, so there's an electrode in there that sends a shockwave into the tissue. It enhances the healing of the tissue if you have an injury or if you're recovering an injury. They have larger devices that you put your anatomy right on, or there's handheld devices that they'll place on the area of abnormality. Just depends on the power structure of the actual unit that's being used. So very common, you'll see that at a lot of recovery centers. Botox, in all the forms of Botox, a lot of people don't think about that, but it's a great chemical to manipulate muscles in your body. We use it to treat arm pump. We use it to treat exertional compartment syndrome in the legs for our soccer players and runners. But really, if you have any asymmetry of your muscle, if you know how to use it correctly, you can manipulate the muscles very precisely and change how they function. You can have one side relax, so the other side can sort of balance out. We've been using this really my entire career to help with musculoskeletal treatments and problems. Commonly, we'll see it for stuff like neck pain, back pain, there's muscle spasms, but in athletes, if they have an asymmetry, this can work really well to help balance that out. What we're known for, we developed a procedure to treat arm pumps. We're the only ones doing this with our specific protocol to treat arm pump. We use Daxify, Botox, several of the other ones. And then again, athletes get this in their calves as well. We treat a lot of soccer players. We just had a player come over from Europe just last week for treatment for exertional compartment syndrome. Arm pump, we'll talk about this a little bit. Lockie, this is what we treated you for, and as a one-time treatment for you, and you're doing great. So the signs and symptoms, essentially, you get swelling and pressure in your forearm. You can actually even visually see it. So if you're doing any type of grip sport, whether you're racing, motocross, racing cars, even BMX, we'll see it in BMX riders, tennis players, any type of grip sport where you're holding and gripping, you can get arm pump in your forearm. It sounds like just like I'm saying. Your forearm will pump up, and then eventually you'll start getting weakness in your grip where you can't even hold on to things. You almost have like a claw hand. You can't really even bend your hand. That's arm pump. So we developed this procedure probably about 12 years ago to treat this. We've treated hundreds, if not 1,000 at this point with the procedure. Awake in the office is Avery Long, one of our up-and-coming pro motocross racers getting treatment in our office. It's an outpatient procedure. We're doing injections of botulinum toxin, which is the generic Botox, into the forearm to treat the areas where the muscles are compressing. So you go through a whole diagnostic protocol and get treated. 30 to 60 minutes in the office in total. Outpatient has an 87% success rate long-term overall. Typically it's done all in the same day. And then oftentimes you're back fully recovered, fully back to your activity within 21 days of the procedure. However, the only absolute downtime is the day of the procedure, day after the procedure, that's it. Instead of a big surgery where you're cutting down your forearm and releasing those tissues. This is a quick walkthrough of what that looks like. This is our clinic in Casper, Wyoming. So our advanced imaging center. We're not this fast. I mean, we're fast, but not this fast. That's the latest X-ray technology. Then we do a simulation of arm pump where he's going to grip while we're scanning him. So we're putting grip dynamometers in his hand. He's gripping while we scan, so we can see where the muscles are pushing on his blood vessels. This will tell us exactly where to target that treatment in the forearm. This is a simulation of the standing CT scanner. So you stand, the machine will come up while you're weight bearing. This is the CAT scanner with your weight bearing. So if you're having hip back leg problems, that'll help diagnose that with you actually standing. Coming up to our clinic now on the second floor for treatment. One of our PAs will go over the imaging with you. So they have the imaging on the screen. We'll review all that. Again, you see some of our jerseys there. Come in for the procedure. Get you all set up and comfortable for the procedure. You see my AR system sitting there in the background. We get this all done right at that point in time. That's it. It's literally that simple. Couple little band-aids on, good to go. Loki, was it that lucky? Was it that fast when it came in? Yeah, that's just to show you what our clinic looks like and some of the stuff we do. These are some of the other treatments that are out there. This is nerve ablation. So if you have chronic pain, if you've had a knee replacement, you're still having pain around those areas, you can go in and essentially burn the nerve or freeze the nerve. That'll decrease the sensitivity to that area. If you're a racer, things like that, it's probably not relevant. It might be parents or grandparents, but this will go in and help treat pain syndromes around the knee. Other technologies, laser therapy, you'll see this at a lot of places. Similar concept to the shockwave therapy. It's just using a very specific orthopedic wavelength laser to treat common orthopedic problems. A lot of it is facilitating that cellular response, the blood flow response to that area, to get your body to fix these tissues, get you back out there. Non-invasive, no sedation, no numbing, nothing like that. Pretty straightforward. This is a device we use. I found this working with some of the NFL players. This is a wearable medical grade ultrasound. So this little device sends an ultrasound, again, a medical grade ultrasound down into the tissue, a few centimeters, and it'll stimulate that tissue to draw blood to that area to facilitate your body's self repair process. I've used this myself many times. In fact, there's a piece it has that weren't too long and irritated my skin, but it does feel good. So anytime I'm working out and I have an injury, I have a couple of these at home. I'll throw it on right away, use it for a couple of days. Feels really good. So it's a wearable. Use it for about 2 hours at a time, usually 3 to 5 days in a row. Works very, very well for pretty much any ache and pain that you get. If you're working out too much and you get some soreness in your joints and your back, you can put this on there. It works pretty well. Newer technology using ultrasound to treat problems non-invasive. Additional stuff, again, you guys, this is pictures here from PitFit, cryotherapy, hyperbaric oxygen, cold therapy. All these things are working on the anti-inflammatory healing process, making sure that you're ready to go and that we're facilitating your body, repairing these tissues, getting you back up. PT is a big one. Again, sort of glanced over this a little bit, but this is the mainstay. I'm just making the assumption it's happening. I guess I probably shouldn't do that at our clinic. It happens. At most professional places it happens. That's why you guys are here. PT is the key to success, both on prevention and recovery. I mean, you really want to make sure that's part of your program on a routine basis. This is some of the other stuff. We actually got to play with some of these. I don't know what your guys' scores are. We're not going to tell you ours. It's probably embarrassing, but we gave it a try. So the hand-eye coordination is really cool. We didn't try ping pong out there, but we did try some of the other stuff here today. All of this is the mental reflex training as well. So preparing your mind to facilitate the success of your body. It's great to see this stuff. It's wonderful that it's happening, and all of you here are getting that right here. Additional considerations, nutrition. Again, I can't really stress that enough. It's there several times. Nutrition. You worry about what's in your car as far as fuel. You worry about what's in your motocross bike as far as fuel, but you have to worry about what's in your body, making sure that you're healthy. You have a diet plan, a nutrition plan that works for you, and then mental health and mindset. Brain is as important as the body. If you're not mentally focused, ready to go, and have someone advising you on that, I really think you're missing out. I think it's like skipping PT. It's like skipping the gym. You want to make sure you have a sports coach, a mental health coach for you as well. Cognitive training, vision training, right? You guys are getting some of that here. And then this is finally the last point here. Don't return to the sport too early after injury. So a lot of times you might be feeling better, but your body is still not fully recovered. You can really do a lot of damage getting back out there too early. So if you have to take an extra week or an extra 2 weeks to heal, that's going to be worth years on your career, right? So those 2 weeks are irrelevant compared to the longevity of your career. So make sure you're taking the advice of your coaches, your trainers, your doctors, and you're not getting back out there too early. If you have to miss a race, listen, yes, you lose some points. It doesn't feel good, but if you come back out next year with the championship, then you won't even remember that race you missed. It's really worth it to make sure that you listen to your body, make sure that you're taking care of yourself. Lockie, congratulations on that Pro 2000 title. That's fun to watch you have that this year. We'll open it up for questions now. So if you're online, if you type in the questions, Diane's here monitoring that, so we'll take those as well. So those online, type them in and we'll get those questions here from the audience.
Do you always take stem cells from the hip?
So the answer is we always take it from the bone, yes. So for stem cells, we get it from what's called your posterior iliac crest. It's the bone like right back here on your backside. So if you push up on your backside, you feel a bone right there. Listen, if I could do it, anyone watching anywhere in the room could do it. I am the absolute wrong demographic for a medical procedure. I'm a male in my 40s and a physician. So it's like the wrong demographics for medical procedures. I was able to do it. I was wide awake. I actually guided my own procedure. So it's not a very painful procedure. We get the bone marrow from your pelvic bone. There's other ways of doing it. There's some that claim that you can order them through blood banks. The FDA has actually shut that down. There's no stem cells in those preparations. There's only growth factors. So places that are using cell preps from blood banks, those are not allowed to be called stem cells anymore. There's also fat-derived stem cells. The FDA has shut most of those down. There's only 1 or 2 kits that are still allowed by the FDA out there. So fat-obtained stem cells have also been sort of shut down by the FDA. So the only ones that really are still allowed on a general basis to be used are the bone marrow-derived stem cells. So from our clinic, we're always getting them from your pelvic bone on the backside. Again, it takes me less than 5 minutes to get the cells out. The discomfort is minimal. I'd say going to the dentist is worse than the bone marrow aspiration. Sorry if there's any dentists online.
No, yes. Should I do grip training if I have arm pump?
No, so that's a good question. If you're dealing with arm pump, the last thing you want to do is strengthen up those forearm muscles. So even if we treat you, if you continue doing grip strength training, you're going to overcome that treatment. So the ones specifically you want to avoid are any wrist curls. Even if you're dealing with this slightly right now, you want to avoid wrist curls because that'll bulk up those muscles. And once they get to a certain point, they're going to push on the veins no matter what. This is an old school thing from motocross, but I still see it occasionally where you'll have a weight and then you'll twist it up. So it's like sort of this grip motion and you drag the weight up. I haven't seen many doing that still. That was really popular back in the 90s and early 2000s. That should also be avoided. And then the hand grip devices, you want to avoid those as well. So if you're dealing with arm pump, those you want to avoid completely. Riding is going to be the best way to get rid of that. Whatever the sport you're doing where the grip is becoming an issue, you want to do those types of training, but no specific grip strength training because you can overcome the treatment and make this a lot worse.
What's the downtime for PRP or stem cells?
Yeah, that's another good question. If you have an injury, whether it's a chronic or subacute, we're very aggressive on treating injuries acutely or even after surgery. So if you went in and had a rotator cuff repair, if PRP or stem cells wasn't injected at the time of surgery, we'd want you injected within a week after that surgery. Now, if we have the luxury of time, now we'll make exceptions if you're mid-season on sports. But if you come in the off season to get this done, or if you're one of the parents that are watching, typically the downtime is 2 weeks. So if we treat your knee for arthritis, for example, we'll have you in a knee brace and crutches for 2 weeks. And then the following 2 weeks, just the knee brace. So it'd be 1 month without exercise for our standard protocol. Now we've treated a lot of football players, a lot of soccer players mid-season for meniscal tears and ligament injuries. We'll tailor it based on the sport or activities. The minimum would be probably about a week off of the sport, but really there's no hard rule. The only thing you're sacrificing is needing it done again. So if you go back too early and it doesn't fully heal, the only bad thing that's going to come from it besides the re-injury is that you need to get treated again at the end of the season. So it's not the end of the world if you're in mid-season. Usually when you come to see us, I'll start with a question. We'll diagnose the injury. I'll say, what are your goals? So if you had the ideal situation for your sport, what would that be? And then we'll work backwards from there and come up with a plan. There'll be pros and cons of that plan, and we'll review that and see what works right for you. So there's no set pattern if you're a competitive athlete in the season. We'll work backwards from what your goals are and tell you the pros and cons of that treatment.
Awesome. Insurance. That one always comes up.
Yeah, it's the bane of our existence, is insurance. They don't like dealing with sports injuries in general for a lot of these things, especially if you're coming from out of state. But we have a whole team that'll work with your insurance companies to try to get as much as we can approved. If it's done on a sort of a immediate basis, oftentimes they'll just deny it outright, everything, even the imaging. But we can work with you on that and find out. As far as the procedures that I told you about, universally the cell therapy is not covered. So PRP stem cells, almost exclusively not covered by insurance. Most of the other stuff is, so the carpal tunnel, the trigger finger, the nerve ablations, all that stuff's covered by insurance. All the diagnostic stuff I showed you, covered by insurance, again, given the proper timing of getting insurance approval.
It doesn't look like you're in Wyoming. Where are you?
That's true, I'm not in Wyoming, I'm in the heart of racing here in Indianapolis. Yep, we're here at PitFit in Indianapolis, and yeah, it's fun to be here and see some of the therapies and technologies that they're using for their drivers and racing community, even a couple of motocross racers, motorcycle racers here too. But
I mentioned earlier that broke my collarbone 4 years ago, and I got a non-union.
yes,
For lack of a better term, is there a statute of limitations for that can be treated? And I passed the point, but I
yeah,
any relief from that.
I never like to say no. If I say no, that means we just haven't figured out the solution yet. So all of that's specific on what you're actually dealing with. So I need to see the images first to give you a more reasonable answer. So we've treated a lot of fracture non-unions, even some that have been there for several years, who've had multiple surgeries, even failed surgeries with bone graft. We treated a competitive mountain bike racer who came up. He had 3 or 4 surgeries to repair a fracture of his forearm, and it didn't heal. He had a plate, he had bone graft, didn't heal. We treated him with stem cells and we followed him with x-rays, and it was incredible. Within 6 months, that bone was almost completely healed. And he was back racing a year later. He got the plate removed on top of it, and went back to racing, competitive mountain bike racing. So I'm not going to say no outright. I'd have to look at your images, and then I can give you a more valid response on that. Typically, we use stem cells for that, and we have a very high success rate, even with chronic fracture non-unions. Good question. Any others? Okay. I appreciate everyone who came out to join us here. I appreciate PitFit here in Indianapolis hosting us. For all those online, if you have other questions, you can reach out to us, McGinleyclinic.com. Anything that you send in related to racing ends up in my inbox some one way or the other. I typically will personally call back all of the racers that reach out. So if you send a message, no matter how off the wall it is, I'll take a look. I'll give you a call back, discuss it. If we can't address it, we'll get you into the right person that will, and we'll get you pointed in the right direction. We've worked with a lot of individuals across the country. Even though they didn't come out to see us or anything else, there's no charge for any of that. We'll get you in with the right person. So reach out, send us a message, and appreciate you joining us tonight. Thank you, everyone.
Awesome, thanks. I think you have to do it.
Bye, Tammy.
Yes. So this facility is awesome.
Yes.
Cool. It's so cool. I did the